My name is Dr. Sanjeev Bagga, and I'll be talking about the common problem of muscle cramps. Please note these slides are only for patient education. My acknowledgement to Merck Manual and AAOS. Um, the most common type of cramps are what are known as benign idiopathic leg cramps. These happen in absence of any causative factor, typically at night. And the second most common muscle cramp cause is exercise related. This may happen during or immediately after exercise. Now, there are some factors which increase the risk and severity of cramps. These could be related to tight calf muscles, and this is typically due to lack of stretching, inactivity, or sometimes chronic lower leg edema. This may be related to dehydration, which means that you've not had enough water and salt intake. It may be related to electrolyte imbalance or abnormalities such as low levels of potassium and magnesium in the bloodstream. And this may be related to neurological or metabolic disorders. And I will not be talking about these causes now. I will be talking more about prevention and treatment. Uh, it is important that one should not exercise immediately after eating. It is a good idea to gently stretch the muscles before exercising or going to bed. Now, drinking lots of fluids, particularly beverages that contain potassium after exercise, are a very good practice to prevent cramps, and not to consume stimulants such as coffee or any drinks which contain caffeine or nicotine. I may mention that coffee, sodas of all kinds do contain caffeine, and medications which contain ephedrine and pseudoephedrine. Now, stretching is very important to prevent muscle cramps, and I cannot overemphasize this particular aspect. This illustration gives you a sense of how you should do stretching, where you can see a person with his front knee partially bent and the other leg straightened out and placed in the back. The person can use his arms or her arms to rest on a wall in front of the person, and while in this position the person sort of bends the front knee while keeping the back leg straight and stretched, and repeat this exercise um, 5 times and hold this for 30 seconds each, and repeat it on both the sides. Now, there are some medications that have been found or they have been prescribed, such as calcium supplements, quinine, magnesium, benzodiazepines, but they have no demonstrated efficacy except quinine, which has been found effective in some trials, but it is rarely ever recommended because it does have serious side effects related to the heart. Now, there is another medication called mexiletine, which sometimes helps, but again, the balance between side effects versus the benefits make it not a very favorite medication. So, what do we do in terms of treatment? Well, stretching is helpful, as I mentioned, and if a cramp occurs, stretching the affected muscle often relieves the cramp. And to give you an example, if you have a calf cramp, then what the patient can do is to pull the toes and foot upward, which we describe as dorsiflexion in our medical terms.